Health and social care are working together increasingly more at the moment, and I think that's a really good thing. If you talk to people who receive services, what they say overwhelmingly are a few simple things. Please come and look after me in my home or local community. If you do so, can you work in a team? We don't really mind which organisation you're from. Can we know who you are? Can you talk to each other? And can you be qualified to do the right sort of things for us? So one of the things I would say that really has to change is that we have to work together in that way that meets the needs of the people we look after.
We're working more closely with health partners now in bringing together the assessment services that we provide to people at home. So bringing social workers and district nurses and other health and social care professionals to sit together and work together so that we give a better, more coordinated service to people.
Richmond House is an intermediate care home for older people, so we work alongside the intermediate care team with the NHS and local authority, and we work to rehabilitate older people to get back into their own homes, whether they've had an accident or they've been ill or anything like that. Richmond House is unusual because we've got the ICT team, which is made up of physiotherapists, occupational therapists, nurses, which is part of the NHS, working alongside local authority, here working together. The joint approach benefits people because both the care staff and the NHS staff are all in one building, so we can communicate better and easier together. We've got the nurses, the physios upstairs, so we can ask them questions if we need to. Everything's more accessible. It's easier to work together to pass on information. It's better care for the service user because they're getting that immediate care straight away.
We know from other places in the country who've started to do some of this work of bringing health and social care professionals closer together that there are real benefits for patients. So people can avoid hospital admission and stay in their own home. They're less likely to go into residential care unless that's really the only option and the option that they and their families choose. So overall, we know from evidence from other parts of the country that this will allow patients a better opportunity to achieve what they want to achieve.
It's about marrying together the various bits of data. It's about being able to look at the Joint Strategic Needs Assessment, which clearly demonstrates the health inequalities that exist, and it's then being able to use robust information to identify where the gaps are in health provision and social care provision. So we'll be able to identify, for example, the patients who are at high risk of heart disease or respiratory disease because of their diet or their smoking habits, and the information that we will have, and we are developing the data sets that we're developing, help us really focus on those patients who are most at need and are perhaps most hard to reach. And it's been able to identify those hard to reach patients, which will start to help us address the complex issue of inequalities of health.